Before we dive deep into the adhesive dentistry, we should know few fundamental concepts and key terminologies which belong to physics of material science. So we are going to learn deep about the fundamentals of adhesive dentistry followed by core of adhesive dentistry. So to begin with, the key terminologies are the adhesion and cohesion. So what is adhesion? It is the attraction force between different molecules. As you can see in this picture here, the red molecule is bonding itself with the blue molecule, which is again a different molecule. So adhesion is the attraction force between different molecules, and the cohesion is the attraction between molecules of the same material. So again, as you can see in this picture here, the red molecule is binding along with the another red molecule, and the bond formed is the cohesion bond. The next terminology is the adhesive. What is adhesive? It is a material that can join substances together which resists separation and transmits load across the bond. And other end, it is the substrate or surface to which an adhesive is applied for bonding. Again, as you can see in this picture here, adhesive is the red one that is applied to the surfaces or the other end or the substrate that is above and below it. So in dentistry, we know there are two substrates, that is the enamel and the dentine, and adhesive is the dentin bonding agent. So what is surface energy? It is the energy per unit area at a material surface. So for the bond or to have a higher bond strength, we should have higher surface energy of a material. And when we have high surface energy, it is easy to adhere because the adhesive forces are more and the cohesive forces are less. So, how do we raise the surface energy? By etching. Etching improves the adhesive wetting and in turn the bond strength. So, what is wetting? It is the ability of liquid material to spread and flow easily over the entire surface and adhere to it. Again, as you can see in this picture here, the theta is an angle between the liquid and the substrate. So when theta is 0 degree, there is complete wetting of the material or the substrate by the liquid. So as in how the contact angle, again, contact angle is the angle between the liquid and the substrate, decreases, there is increase in the surface energy of a material. What is the surface energy of a material? It is the energy per unit area at a material surface. We always aim to get a higher surface energy. How do we get a higher surface energy? By decreasing the contact angle, which in turn reduces the surface tension of a liquid. Now, there is a difference between the surface tension and the surface energy. Surface energy is the energy per unit area at a material surface, and surface tension is the force with which the molecules are held together at a material surface. So, the force with which the materials are held together at the surface of a liquid should be low. That's when the angle will be low and contact angle between the liquid and the substrate, which increases the adhesive forces, and thus in turn it increases the surface energy, and hence the wetting increases, which in turn increases the bond strength of a material. So I hope it is clear that surface tension and surface energy are two different concepts. Surface energy again is the energy per unit area at a material surface, and surface tension is the force with which the molecules are held together at a material surface. Always the surface energy should be high, and ultimately when the surface energy is high, the surface tension decreases. And when the surface tension is low, the wetting is high. Again, when you see in this picture here, when there is obtuse angle between the liquid and the substrate, there is less wetting property, and when there is 0 degree, there is complete wetting of the material by the liquid. So contact angle, it is the angle formed by the adhesive with the other end, that is the substrate at the interface. As we have seen here in the previous slide itself, that the theta, the angle between the substrate and the liquid is 0 degree, there is complete wetting. So the contact angle is inversely proportional to the wetting. Lesser the contact angle, there is high or good wetting of the adhesive. So, for a good bond to take place, we should have high surface energy, which will have low surface tension, which will have in turn increased wetting property, and wetting property is dependent on the contact angle. When the contact angle is less, the wetting is more. So, mechanisms of adhesion. The adhesion is bonding of dissimilar materials by the alteration of atoms and molecules. As we have seen in the previous slides itself, adhesion is the attraction force between dissimilar molecules or different molecules. So, how does the adhesion takes place? It is by three mechanisms, that is electrostatic, mechanical, and chemical. In dentistry, we rely morely on the mechanical and chemical mechanism. So, electrostatic adhesion, it is the adhesion caused by the attraction between oppositely charged surfaces until electrical charges are balanced or neutralized. So, examples we see in everyday life are the static cling between cloths and the skin, that can be hand or a leg. That is when the cling attaches itself with the clothes or the skin. Mechanical adhesion. This is the type of bonding in which the adhesive penetrates surface irregularities or roughness of the substrate, and upon solidification, it interlocks mechanically without relying on chemical interaction. So, the adhesive penetrates into the substrate and it interlocks mechanically, so it doesn't rely on the chemical interaction in mechanical adhesion. So, in dentistry, acid etching of enamel creates microporosities, and resin flows into these spaces and polymerizes. And when these resins flow into the microporosities that are formed in the enamel, is called resin tags, and they lock mechanically into the enamel. Chemical adhesion, it is the bonding between dissimilar materials through atomic or molecular interactions at their interface. Mechanism is by attractive forces or chemical bonds. As we know, chemical bonds can be covalent, ionic, or hydrogen bonds that are formed at the interface and holds the two phases together. So, chemical adhesion can again be of two types, that is adsorption and diffusion. Adsorption is the attachment of molecules from one phase onto the surface of another due to intermolecular forces, and diffusion, it is the intermingling and migration of atoms or molecules across the interface, resulting in bond formation. So, at the end of this, we have to know clearly that mechanisms of adhesion are of three types: electrostatic, mechanical, and chemical. But we rely mostly on mechanical and chemical. Mechanical is by acid etching, which forms roughness and microporosities in the enamel, and and the liquid flows into, or the resin flows into the roughness that is created in the enamel to form resin tags, and it doesn't rely on chemical adhesion. In chemical adhesion, we rely on bonds that are formed They can be of three types: covalent, ionic, or hydrogen bonds. We move on to the next part of this presentation, that is the two substrates and their bonding characteristics. As we all know, there are two tooth substrates, that is the enamel and the dentine. So first we look into enamel bonding followed by dentine bonding. Successful dental adhesion is predicated on thorough understanding of the unique properties of two primary substrates, that is, the enamel and dentine. While both are mineralized tissues, their composition and structural differences necessitate distinct bonding protocols. So, enamel bonding, its mechanisms, requirements, and challenges. Composition of enamel is 92 to 96% mineral, that is hydroxyapatite, more or less 4% water, and minimal organic matter. As we all know, enamel is acellular, thus it is non-vital and has low permeability. The permeability should be low, and this causes ideal for bonding. The structure of enamel is it has prism like rods that is of 4 to 8 micrometer in diameter, arranged in organized patterns, which gives enamel strength and its anisotropic properties. So, Dr. Michael Bunno-Kaur was the first person to introduce acid etching of enamel with phosphoric acid in 1955. This improved the resin enamel bonding. Earlier, there was skepticism about using strong acids in dentistry, but later research confirmed its effectiveness. Now, contemporarily, we use 35 to 37% phosphoric acid. Mostly commercially, 37% phosphoric acid is what is available, and it is applied for 15 seconds. And this works for both prismatic and aprismatic enamel. So, prismatic enamel has structures like these rods and interrods, and aprismatic enamel doesn't have these rod like structures. And aprismatic enamel are mostly seen in primary teeth and in the cervical regions of the permanent teeth. So earlier they were following different protocol for aprismatic enamel because they didn't have, I mean, the aprismatic enamel doesn't have the rod and interrod structure. It is devoid of the prisms, so it is highly resistant to acid etching. So they use it more invasive techniques like abrasion, sandblasting techniques. But the research has found out that 37% phosphoric acid applied for 15 seconds works well for aprismatic enamel as well. So phosphoric acid remains the gold standard, though alternatives exist. So alternatives to phosphoric acid are citric acid, carboxylic acid, and malic acid, to name a few. But citric acid is not practical because um, it requires long exposure times. Carboxylic acid show promise, but data on long-term bond strength is not available. The same with malic acid. It shows bond strength comparable to permanent enamel, but again, it requires clinical validation. So, all these years, we have tried and tested phosphoric acid, and we rely on phosphoric acid for acid etching in dentistry. What are the goals of enamel etching? The etching cleans the enamel surface, removes the smear layer, and partially dissolves mineral crystals, creating microporosities. It also increases surface energy and lowers the contact angle, which in turn improves the resin wettability and penetration. Optimal bond strength is achieved only if the etched surface is clean and free from saliva or organic contamination, and microporosities that is formed by acid or enamel etching allow resin infiltration, which results in mechanical interlocking and hybrid layer formation for strong and durable bonds. So, factors influencing etching pattern are acid concentration, duration of the etching, and orientation of the enamel rods. Types of etching patterns, there are three types of etching patterns, and type 1 is the most common and desirable one, whereas type 2 is least desirable. Type 3 is mixed of type 1 and type 2. So, in etching pattern of type 1, and the most important part is you might get a viva question where they ask who discovered etching patterns. So it was Silverstone who described or discovered these etching patterns, and he has found three types of etching patterns. So the type 1 is where the acid dissolves the core of the enamel rods and peripheries remain intact, which creates deep funnel shaped microporosities. This creates excellent resin penetration, which is best for bonding. Again, as you can see in this picture here, adjacent to the type 1, you can see the core of the enamel rods are dissolved, but the peripheries remain intact. So, this is the characteristic of type 1 um, etching pattern. In type 2, which is less ideal, it dissolves the peripheries of the rods and cores remain intact, or they appear as convex mounts, and this results in weaker mechanical retention compared to type 1. And type 3 is mixed pattern, no clear selective dissolution, and it is a combination of type 1 and type 2. And it can occur if etching time is too short or too long, and it produces inconsistent surface for bonding. So, what is the clinical significance, or how do you know that you have etched the enamel surface completely? The visual indicator of etched surface is frosted or chalky white appearance of the enamel after rinsing and drying it. And this is a strong foundation for the adhesive bond. Again, as you can see in this picture here, you can see chalky white frosted appearance of the enamel. This is the classic visual indicator for knowing if we have successfully etched the enamel surface. So, in contrast, the under etched or over etched surface can compromise the bond strength, and this leads to micro leakage, staining, and in turn, the restoration failure. Requirements for optimal bonding. There should be sufficient enamel thickness, that is ideally more than 0.5 mm, to ensure resin tag formation. Proper etching protocol, that is 15 to 30 seconds of 37% phosphoric acid is applied and rinse it thoroughly. Then air dried. You have to see a chalky white appearance, which is a clear indicator for your successful etching. And prepared enamel bonds more predictably than aprismatic enamel. So air abrasion or grinding before etching helps, especially in cervical regions. Bevels on margins. In anterior restorations, enamel bevels or margins are given to increase the bonding area and facilitate blending with the adjacent teeth. Strict isolation, this is very critical. Usage of rubber dam because it prevents saliva or blood contamination. And if there is any contamination, it reduces the bond strength. So, what are the challenges of enamel bonding? As I have already informed, it is the aprismatic enamel that is resistant to etching and may require more aggressive surface preparation. Hypomineralized or fluorotic enamel may also need extended etching or pre-treatment. Contamination with saliva or fluids rapidly compromises the bond, so meticulous isolation with rubber dam is very essential. We move on to the next part of this presentation, that is the dentin bonding, the most important part of this presentation, the mechanism, requirements, and the challenges. We all know dentin bonding is more complex and less predictable than enamel bonding due to its composition and nature. The composition of dentin is approximately 50% inorganic, whereas in enamel it was 90 to 95% inorganic. Inorganic consists of hydroxyapatite crystals and 30% organic, that is mostly type 1 collagen fibers, and 20% water. Dentin contains millions of microscopic tubules with odontoblastic processes and fluid, dentinal fluid, which complicates the bonding. Smear layer, which is comprising of hydroxyapatite, collagen, and debris, is formed during dentin preparation and must be managed to ensure successful bonding. So, what are the components of dentin adhesive system? There are three basic components that are the etchant, primer, and bonding resin. Etchant is phosphoric acid in concentration between 30 to 40%. As we have seen earlier, 37% phosphoric acid is the most commonly available. The phosphoric acid gels are thickened with silica microparticles, although there are few that contain other thickeners such as xanthan gum. A color dye is always included to improve the application accuracy and ensure that all gel is washed off. It should be contrary to the tooth surface to allow the clinician to know if he has washed the gel completely or not. Glycol is often added to improve wettability and decrease the viscosity, and the etchant is always rinsed off from the tooth surface. Primer, this is the second component of the dentin adhesive system. So, it is a hydrophilic solution of resin monomers. Organic solvent, this can be alcohol or acetone, water, and stabilizers. The hydrophilic groups boost the wettability to the dentin surface, and the role of primers is comparable to the primer in paint. The primer adheres to the surface, forms a binding layer to receive the bonding resin. Primers are not usually rinsed off or nor cured, they are just simply air dried. This is very important to know because etchant is cleaned off with water, primer is just air dried. In contrast to the adhesive system, adhesive resin, it is light cured. So, what is adhesive? It's a thin solvent free resin applied over the primer and light cured. Its hydrophobic groups bond with the restorative material, making the dentin bond stronger and long lasting by preventing leakage. The hydrophobic resin also helps the primer set faster. Smear layer, it is a debris layer formed on the dentin surface after cutting with rotary or hand instruments. Again, as you can see in this picture here, this is a dentinal tubule. The smear plug is the one that is formed inside the dentinal tubule, and smear layer is the one that is formed over the surface. And what is a smear layer? It is the debris that is formed on the dentin surface, which is found after cutting with rotary or hand instruments. It typically has measurement of 1 to 2 micrometers in thickness, and the one that obstructs the dentin tubules is called the smear plugs. The composition of smear layer reflects the underlying dentine and may include the hydroxyapatite and collagen fragments. There are two schools of thoughts again. which is to remove the smear layer or not to remove the smear layer. So if you remove the smear layer, it increases the dentin permeability and it leads to post-operative sensitivity. In contrast to this, if you allow the smear layer to be intact, then the bond strength decreases, or in some cases, the bond doesn't happen itself. So we move on to the next key concept, which is very important in dentin bonding, that is the hybrid layer. The hybrid layer is formed by the infiltration of adhesive resin into the demineralized dentin collagen network. It serves as a micromechanical interlock between the resin and the dentin. You can see in this picture here, the hybrid layer is in between the resin and the dentin, creating the adhesive bonding. Here is the resin. This is the resin and this is the resin tag. And here is our hybrid layer between the resin and the dentin. So it forms, or it acts as a mechanical interlock which creates foundation for adhesive bonding. It provides an effective seal of dentinal tubules, reducing dentin permeability, fluid movement, and post-operator sensitivity. Hybrid layer is susceptible to hydrolytic and enzymatic degradation over time, which can compromise the bond stability.